Frances was 45 years old when she suffered a stroke. Getting into rehab right away speeded her recovery process. Frances invited Health TV to spend time with her and some team members.
When I first had the stroke, I couldn't feel my leg at all. It was completely numb. And my arm, it just hung flaccid to my side. No tone at all. And no sensation. Well, I've come to terms with it, and I feel happy now that I'm beginning to walk with a walking cane. And I feel happy about that. That was my main goal, was to walk again and to start to move my hand, which is starting to move a little. Yeah. It hasn't got an awful lot of strength, but it's getting there. Same with my leg. The muscles are beginning to get stronger every time I stand up. Things, you can feel your legs actually got a bit more power in them than the last time you stood up, you know.
Just relax that shoulder, okay? Good.
When we wash them and teach them to dress, sometimes they'll sit there for a little bit, and you give them that time, not rushing them. So it depends on the other health problems that they have, because it's not just like Frances, who had no risk factors.
At first I was very angry and kept asking myself, why have I had a stroke? Because there was no risk factors in my family. No one in my family's ever had a stroke, or I'm not a smoker, or I haven't got diabetes, and I eat a healthy diet, so I haven't got a cholesterol problem, so it was a complete shock to me to have a stroke.
Physiotherapy, we work on getting people moving. When a therapist works with someone's mobility, when I'm referring to mobility can be in different areas, and very simple mobility, their ability to move in bed, some very basic needs they have to be able to get out of the bed, and very often they will require assistance in resequencing their ability to do that. Working on their sitting balance, working on their standing balance. They need standing balance to be able to dress, to be able to do those very, everyday basic functioning needs.
Hold yourself steady.
When you work with stroke patients, you're doing a lot of teaching. They're relearning. They're relearning to dress themselves, to talk again, to sit straight, to stand straight. So I always approach it from that.
I couldn't move at all when I first come in here. The first person I saw was the nurse that was going to be the main nurse that was going to look after me, which is called Kathy Nelson. And she's so good, because she assured me that she would get me back doing all these jobs for myself again, and she said, with determination you can do it, and I'm going to make you do these things. And every morning she used to set my clothes out for me and say, right, get on with it. And I used to think, well, I don't think I can do that. But she wouldn't help you. She wouldn't help me, because she knew that this part of rehab is to do things for yourself, to get you back into the community again and do for yourself again and be independent. I thought at the start it was rather hard for someone to say, there's your clothes, get on with it. But not really. I can see her point was that she just wanted me to be able to get back to how I was before.
This is the left side, which is weak, okay? She's going to move her hip. This is the strong hip. And sometimes when she first got here, we had to use our hand here to lift this hip. So what happens now? The foot, you've moved the placement of the feet. So the patient is near the edge of the chair, her legs are spread, and then you get her to push up. And what you do is you're creating pressure through the weak side. And that's what we use at this hospital. They call it the neurodevelopment treatment, or the Bobak method, right? And we can transfer the patient on the strong side or on the weak side when it's appropriate, because sometimes the leg is too flaccid. When she came at first, we could not do it. There was no movement in either the arm or the leg. Absolutely none. Right? And then we but we still used it. Pull it up and get her to be aware where the hand is placed, because, as I said earlier, the orientation to the left side of the body, the brain, nothing. She was just not looking on that side at all. So she's really done a great job.
Yeah.
Sounds like everybody's done a great job.
She was very motivated too. Now spread your feet, Frances, so that they're apart. Just move your hips from the back of the chair to the front. Slowly does it. Again, a little bit more. You think you're far enough forward? Because you have to try to maintain the standing balance.
Okay, that's fine.
Push up and stand up. Now step with this foot first. Step. Good. Towards the bed. We're going towards the bed. Slowly. 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 That's it. Sit down. Look over to the left a little bit. That's it.
Okay.
It's a perfect sit.
Oh, good.
Straight.
I think you must have a positive approach to if you've had a stroke. You've got to keep on working at saying, well, I will overcome this. I will get over this. I will get back walking again. I will achieve most things I was doing before. I will get back to normal mobility, and I'll be able to shower again on my own and manage to cut my own food up again. It's just small things, but it's very important, just to be back to normal and being a human being again with the love and support of people who care. That's what gets you over strokes too.
That was a good session, Fran. Did good work. Nice control through your leg and arm. Okay, why don't we head out then? We'll go back to where your chair is in the hall. Now remember, stepping through with that right foot, please. Good. Keep your balance. You need to look up. That's right. Nice and smooth.